I want to get to fertility treatments. So what about endometriosis? What about stress? How does that impact fertility? What is holistic reproductive women's healthcare? What does that mean when we say holistic?
We are treating women as a whole person, that we're more than just our physical ailments, understanding the root causes and really utilizing all modalities, not just conventional treatments. In my prior life, no matter if that woman was coming to me for painful periods, if they had acne or abnormal hair growth, I would tell them to go on the same exact treatment, which was a hormonal contraceptive. And it just felt very incomplete. This is your own body, this is your own journey, this is your life. You absolutely deserve to get the full answers.
Dr. Lauren Rubal, welcome back to the show.
Thank you for having me again.
You're my favorite.
Same, Lila.
We did an episode last year on your story, which is super compelling. I mean, people loved it. And then we have an episode, I think it's coming out, so these are coming out during my maternity leave, and the other episode is you're breaking down all of the details of IVF because it's a lot of confusion about it. Fascinating stuff. Today we're going to talk about healthcare, hormones, fertility for women, the positive solutions.
Yes, exactly. I'm excited to get into it.
So first of all, you're a doctor, you're an OBGYN. Mm-hmm. Why are you so passionate about women's holistic healthcare?
Oh, that could take another hour just on and of itself, okay? I am very passionate about it because first of all, as I shared in my other episodes, I felt for so long I was treating ovaries in a vacuum that I wasn't able to provide healing and answers to a lot of issues. Mm-hmm. I was giving birth control as band-aids in many ways, I felt. And so from that perspective, I didn't feel like I was doing a full and complete job in helping care for the women and girls who are seeing me, number one. Number two, I think that a lot of the current treatments that are in use are, quite honestly, the opposite of what our natural bodies do. That they are not perfect, that they have significant potential for side effects and risks. And I think that there's so much more that's largely still not known in conventional medicine. And so for that reason, I feel very inspired to, share all of this because it's a common condition that many women suffer with is issues with their periods or with their fertility.
What's so fascinating, too, is you've been on both sides. So you've done the birth control prescription route. You were involved in an IVF clinic working there. And now you're doing holistic fertility. You're doing holistic women's healthcare. What is holistic reproductive women's healthcare? What does that mean when we say holistic?
Yeah, great question. So we think about it, the terms that are very commonly used is restorative reproductive medicine, or RRM, because we love our acronyms. Or I also think of it as integrative gynecology or integrative fertility. And so essentially what that means is that we are treating women as a whole person, that we're more than just our physical ailments. And so it's a very patient-centered approach, looking at mind, body, soul, understanding the root causes by assessing hormone imbalances, inflammation, other organ systems, forming a partnership with your physician so that you two can walk alongside each other to determine the best plan of care for that patient. And really utilizing all modalities, not just conventional treatments, but really other approaches such as foundational lifestyle changes, as well as judicious use of nutraceuticals, botanicals, so supplements and whatnot as well. And so integrative medicine was a fellowship that I did, and it was revelatory. It was around that time when I'd left my prior practice and I was really searching for how to be able to provide authentic and full and holistic women's healthcare, that I discovered that integrative medicine was this approach, that it really was full circle. And I also discovered the value of fertility awareness-based methods. And, this was a big deal because I was the purported expert in women's health, and many of these things I felt like I'd never heard about before.
In all your training before that, before your fellowship, you had never really heard about fertility awareness methods,
or it had been brushed over, and it wasn't something that was as focused on as I think it should be.
Okay, so let's start with the landscape of what women are even struggling with regard to their reproductive health, and then walk us through how it's currently typically treated.
Absolutely.
when women walk into their doctor's office.
Yes. And so when I think about it, you know, of course, for GYN causes, meaning many women are suffering from painful periods. And in fact, about 10% of women worldwide will have a condition called endometriosis, which equates to about 190 million women globally.
10% of all women
Yes.
have endometriosis.
Correct.
Wow.
So that is a lot. When we think about women who have irregular ovulation, which will lead them to have irregular cycles, so not that monthly period that women who ovulate regularly have, again, that is a significant amount of women. So the most common condition that can lead to these irregular ovulatory cycles is called polycystic ovary syndrome. And this can also affect about 5 million women in the US. It's very common. It's about a 10%, almost 6 to 12% incidence. And so again, huge numbers. For the two most common reasons, I'll see someone who is dealing with abnormal periods. For fertility, we know that there's a new study by the CDC showing that 17.5% of couples will deal with infertility. That's 1 in 6 couples, roughly. This is worldwide.
Are those numbers up?
Yes, that is from last year. I think it was published in
So the
April.
infertility challenges are increasing.
Correct. Yes. And they're all, yes, correct. I thought you meant recent, but yes, they're also increasing. It seems like overall, and again, recent studies showing that even for men in the Western countries, they did a recent study showing that sperm numbers have declined by about 50% over the past 40 years. And so we know that many people are struggling with this, absolutely. And so I'd love to talk next about, like you said, what is the typical course when someone comes in and presents. And so this was part of what was such an issue that I realized when I was practicing in my prior life. I felt like no matter if that woman was coming to me for painful periods, heavy periods, irregular periods, too frequent periods, if they had acne or abnormal hair growth, I would tell them to go on the same exact treatment, which was a hormonal contraceptive. And it just felt very incomplete again. That I wasn't able to determine the why as much as I thought I should have. And so it wasn't only the sense of not understanding the why and the cause of why people were dealing with this. It was also the fact that with this same treatment that I very commonly prescribed in the past, and I put up people on, they didn't really seem to be always satisfied with. I mean, for multiple reasons. But in fact, there are studies that show there are a lot of women on hormonal contraception. In fact, 99% of all women in the US have used contraception at some point in their life. Out of those, 88% of those used hormonal contraception.
Wow.
It's huge numbers. Currently, about 65%, I believe, of women aged 15 to 49 are using contraception. And so this equates to about 47 million women that we're dealing with and that we're talking about.
It just makes me think immediately it's a huge industry to have 47 million women on some form of, I think it's hormonal contraceptive. I mean, that's a huge industry for the pharmaceutical industry that creates these pills. To have that many patients all using their same drugs.
Exactly. And I think that number is for overall contraception. Okay. But certainly it's still tens of millions of women, okay? And why is that an issue? Well, I mean, first of all, what does the hormonal contraceptive do? When we think about it from the perspective of what our own bodies do, the hormones that are produced by our ovaries and work throughout our bodies, there's this beautiful cyclicity and rhythm and change and variance throughout the course of a cycle. And believe it or not, these have effects in every different organ system from our brains. There's really interesting research looking at that. Again, they affect every other organ. There are receptors for these hormones in our other organs. And we contrast that and what should naturally be happening to what, for example, birth control pill does, it creates a flat line. It's mainly what we call progestin, which means all types of progesterone, progestin-based response. So progesterone is, I think, pro-gestation, so that's a pro-pregnancy hormone. That hormone typically is produced naturally after we ovulate. So after the egg's released, and it really prepares and readies our lining for a baby to implant. And so that's its goal. But it goes down after if a woman doesn't get pregnant and then isn't present the entire cycle the way it overall is with the pill. And so you're having this like flat line of hormones overall compared to that cyclicity. So that's one big issue. I mean, the second issue that a lot of people have raised is, well, if we're acting and using this progesterone, this pregnancy hormone, kind of on a very long-term basis, that isn't what our bodies are necessarily going to be naturally used to or should be used to, okay? And so that's another question that gets raised. And then when we think about the actual hormones that are used in these contraceptive methods, they are not the same as our body's hormones. It's a different chemical structure, in fact. And because of that, they can confer different effects, and that's why they can cause different effects. What do I mean by that? Remember, hormones are just messengers. That's the way that our brain communicates to other parts of the body and how they talk back. And so they have receptors that they will kind of sit in. And these synthetic hormones, they actually will sit in the receptor typically longer and stronger, so they have greater potency. And so this can lead to issues like an increased risk of blood clots in the blood vessels. There's a 3 to 5 time increased risk of this, and
3 to 5 times increased risk of blood clots in the vessels for those on hormonal contraceptives.
On estrogen-containing contraceptives, which are a good amount of them, absolutely. This can be deadly, unfortunately. Women who have clots that can go to their lungs, a third of the time die from them. So it is not insignificant, right? Thankfully, these numbers are low, but as we age, these risks can go up. I read a study that said there was a 2% chance of that happening by age 50 just at baseline, okay? So again—
2% of the women using—
Of just women in general.
Of women in general.
Yes.
Wow. And that's increased 3 to 5 times if you're using a hormonal contraceptive with estrogen.
Correct.
Estrogen-based. Wow.
Correct. And so I think another compelling risk that we have to be aware of is that these hormones, again, they're being given a stronger type, a more potent type. They're being given in a different way than our body naturally produces or uses it. And so what we're finding too is that there's an increased risk of mood disorders. So what does that mean? That means things like depression. And in fact, they did this huge study in Denmark, 1 million women, and they found that there was an up to 3 times increased risks of depression and even suicidality. And this may persist even after discontinuation of the pill. And so, again, this is very concerning because we know we're facing a mental health crisis already. And we also know, again, how common many teens are on this, and it just becomes almost like a perfect storm.
What are any other risks of hormonal contraceptives, of the birth control pill?
Another one that may be an issue is that there's an increased chance for gastrointestinal issues. And so hepatic, which means liver tumors. It can also increase risk of ulcerative colitis or Crohn's, which are issues dealing with your gut, with your colon, and GI tract. So we know that can also occur. So
any cancer risks?
The cancer risks are controversial still, and it's not clear. However, it does appear there was a recent paper published that showed that even progesterone only, so not even containing estrogen, hormonal contraceptives, may increase breast cancer risk. And so we do feel like there could be increases, although, again, there are some studies that say yes, some studies that say no. So I feel like there is some gray area there.
The Washington Post had this article recently. I don't know if we already talked about it off camera, but the headline was, something about the misinformation that is scaring women off of birth control and claiming that there was nothing in the article that was critical of birth control or to say that, didn't mention the Denmark study about suicidality and mental, depression and representing itself in these women, on the pill in a disproportionate amount, obviously. It doesn't mention anything about blood clots. These are all somehow a myth, according to the Washington Post, and they kind of focused in on, I think, right-wingers and influencers online who are sharing this information. I mean, is this an American phenomenon? I don't know if you can answer this, but Denmark is doing a study of 1 million women, and this information is available. Obviously, you can see it in the United States, but why is it so controversial to tell the truth about the harms of birth control in the United States?
Oh, I would say that there, as you mentioned, there are probably a lot of forces at play that very much are interested in women being on these modalities, quite honestly. But I think also that it's multifactorial because when we're in school, of course, to be frank, there's more data, of course, coming out. But I know that I didn't feel like I was taught completely about all of these, okay? In the sense that, again, there's more of a focus on the benefits that I can have. And it's again, not as diverse of opinions in some ways, number one. Number two, even when I was counseling patients, I'm ashamed to say, I don't feel like I fully was talking to them about all the potentials, okay? And then third of all, I think that there's just this odd kind of position that medicine sometimes gets in where it's the physician knows all and this patient just has to acquiesce to what the recommendations are. I think debate and questions, that is the essence of the scientific method. And that is the essence of being in charge of your own health, actually. And so I firmly encourage all women to be their own best advocate. I say it every time. And it shouldn't be something that is relegated to whatever they said, influencers or whatnot. This is your own body. This is your own journey. This is your life. You absolutely deserve to get the full answers. And unfortunately, if you don't feel like you're getting it from your physician, there are other doctors, number one. But there is data out there that you should absolutely be inquiring about and asking your physician about.
GoodRanchers.com is American meat delivered. Did you know that 90% of the meat in your grocery store doesn't come from the United States, even if the meat packages say product of the USA on it? That's a little trick that a lot of meat manufacturers use as they import it from other countries and then they can slap on product of the USA. Not so with Good Ranchers. Good Ranchers is sourcing 100% of its meat, poultry, pork, and seafood products directly from U.S. ranchers. And you can tell by the products. The beef is just better. The chicken is delicious. You're not going to find chicken like Good Ranchers chicken at the grocery store. Usually it's stringy or it's rubbery. It's not as flavorful. Good Ranchers chicken is delicious. Good Ranchers also has a very special deal going on right now that if you order a subscription box of meat and chicken, you will get free chicken for an entire year, an additional 2+ pounds of chicken per box. You can get that great deal by using the code Lila at checkout at goodranchers.com. Check them out. You won't regret it. That's goodranchers.com, and you can use the code Lila at checkout for a year's supply of free chicken. So earlier you were saying the common treatment plan for women coming in with these different issues with their periods or with, seeking, they have acne, cystic acne, or they have these different conditions. They're frequently just told to go on the pill, basically. Mm-hmm. And you're talking through the different disadvantages of that for these women. Number one, they're not addressing the underlying condition. And then number two, there's the side effects of birth control. Talk more about those underlying conditions. So that's where it gets really interesting. I mean, obviously, birth control, we could talk a lot more even about some of its harms. I think we've kind of run over some of that. But what are these underlying conditions that women have in your expertise? And what are the solutions instead of just giving them the birth control pill?
Yes, absolutely. And so I'll go over the more common ones as I touched upon earlier. So one includes irregular periods. And there's actually a myriad of causes for this or there can be more than one issue. What that means is a woman isn't regularly releasing that egg. And so the most common cause, about 70% of the time, is that condition called polycystic ovary syndrome, or PCOS. What that is essentially an imbalance of the male to female hormones in the body. We have male hormones as well as female hormones, but it's very intricately controlled. And if there's a relative increase in male hormones, it can either be present and identified in the blood when we do lab tests, or it can also be present clinically. And so women will deal with a lot of unwanted hair in locations like their upper lip or their chin, chest, and others. Or they can also have very bothersome acne on their face, chest, or back. And so it's a condition that causes a lot of suffering, quite honestly, as well. And so it can be associated. And the reason why it can be such an issue is because it also has as its cause many times insulin issues. And so as insulin is the counterpoint to glucose, which is sugars, that insulin can affect weight, potentially can affect and increase the risk of developing metabolic conditions down the road like diabetes. It can be involved in even cardiovascular issues, again, down the road. And therefore, helping to heal these women who are dealing with this very common PCOS condition is really important because we're going to prevent, hopefully, those downstream issues, okay? And so what does that mean? So what that means to me is we can employ an integrative approach for PCOS, okay? What does that mean? What that is, and when we think about those pillars, we have the foundational lifestyle factors, okay? And some of these things I tell people, it's like, it's what our mothers told us. And so it's not necessarily these fancy, complex treatments.
You don't necessarily need drugs for it.
Yeah. But it also does require a lot of, ability to stick to something. And that's why it's good to have a good plan and to walk alongside someone who can help you with this, because it may feel overwhelming, okay? But the lifestyle foundational ones are good nutrition, food is medicine, is a regular exercise routine, is sleep and really having restorative sleep. It's also the intangibles. So this is, having the mind-body connection, right? Being connected to God, to other humans, things like that, right? And then on top of that, when we establish that foundation, we can also use our knowledge of how can we limit maybe environmental toxins. There's some interesting associative studies looking at, for example, BPA in plastics and potentially impacting PCOS development. There can be different supplements that we use that have been shown in research and studies that are as effective as some of the pharmaceuticals we use. And so for me, when I see a patient with PCOS, we want to make sure we're working on healing their insulin levels. Again, there's some interesting supplements like inositol, berberine, and acetylcysteine, which is a precursor to the most potent antioxidant in the body. We'll be using that in conjunction with other ones that help with antioxidation, which is fighting off those free radicals. And so that could be even fish oils and omega-3s. So we develop a plan together to help with not only restoring the male-female hormones, but also working on the insulin, working on the inflammation. And then we continue watching together. I'm happy to report that it works. That really I've seen amazing things where women have and resume normal cycles.
Wow.
And they feel better and they have less symptoms. So it's very exciting to, again, from where I came from to now where I am, and really truly feel like I'm helping heal people.
So if you have a patient presenting with PCOS symptoms and you diagnose PCOS, is part of the diagnosis doing a test for their insulin levels? How important is the insulin piece? And is the insulin piece, is it healed by, I think you mentioned different supplements or botanicals, but is there a nutritional plan for that too?
Oh, absolutely. So that is one of the foundations, right? And so what's interesting is that not everyone looks at insulin specifically. And so there are different ways to assess for how their sugars have been. And I have to say that, again, part of restorative reproductive medicine is really digging deep immediately, because we don't want you to get to the point where you're already at a pre-diabetic stage and we're diagnosing that. We want to nip it in the bud prior to that, when we see an elevation in your insulin, for example, and then we say, oh, let's work on a nutritional strategy. Let's work on potentially, again, exercise is so important. And let's focus on how we can help with weight, which is, in many PCOS women, very difficult to lose. And again, it's not for lack of trying. They're doing their best, but it's also because of these metabolic changes, including the insulin. And so the supplements, I always tell my patients, I don't want them to be on supplements forever, but I actually use it as a bridge as we're changing the foundation and coming up with a new plan.
I am curious. This is a theory. Tell me if you think this adds up. But if you're presenting with PCOS as a woman, you go to your average doctor. They give you a birth control pill because that's going to suppress some of these disorders between the male-female hormones that they're experiencing. The birth control has its other side effects that you're dealing with. Because of the PCOS, if you had been trying to get pregnant at the time, you might have had some trouble anyways. And then you go forward, get off the pill at some point, you turn 34, you want your first baby, I don't know, you get married. Yeah. This is a story for a lot of women, by the way. And then all of a sudden they're like, well, I'm off the pill, but I can't get pregnant now. Do you think a lot of the fertility issues today, I don't know if you can weigh in on this, but how many of the fertility issues may be connected to, there were underlying conditions and issues the woman had. They put the Band-Aid of birth control on top, which actually ended up having its other issues. And then they took the Band-Aid off and the underlying issues are still there. And now they're like, what's wrong with me? Why isn't it working?
This is so common, Lila. And this is exactly the reason behind restorative medicine. Because here's the thing. As we talked about last time, even when we look at IVF, which is you make the baby with IVF, right? You have an embryo. The pregnancy rate with IVF is not 100%. The pregnancy rate with IVF is not even 50%. And so if we've made the baby, so what's the issue here? Well, the issue could be that there is something going on with the embryo, with the transfer that was done, with the uterine environment, with the mom's environment, maybe even her immune system, or her hormone imbalances or inflammation. There's so many different factors, right? And so by using restorative reproductive medicine, instead of putting those Band-Aids on, we're trying to heal those causes. So when women are young, this is why we should be teaching how to chart, because it really is the fifth vital sign that once we see there's an issue, we can nip it in the bud, like I said. And then when that woman is trying to conceive years down the road, if she deals with infertility, she's able to really understand that. And also, a lot of these issues, we talked about PCOS and the metabolic implications. This may have an impact on the health even of her pregnancy, on certainly her future health. And so if we want to have healthy moms giving birth to healthy babies, it really behooves us to try to understand and help them at the root, okay? And so to answer that question of, well, now what do we do? I just always feel so sad because that happens a lot. And they say, well, my period didn't come back. I'm not ovulating. And it's like, okay, yes, because unfortunately we didn't correct the issue. We just suppressed it. There is, the birth control pill does help decrease free levels of testosterone, which is a male hormone. So it does help in that regard. But again, it's not going to fix PCOS. I've actually had patients come to me who said, I've been trying to get pregnant, but then I was offered a birth control pill because I'm not having regular cycles. And that just that's a lot of dissonance for me, because that's going to prevent pregnancy, right? And so it's like, the answer is not delaying time to pregnancy. The answer is trying to correct what's going on.
Every morning when I wake up, I love to make myself a steaming cup of 7 Weeks coffee. 7 Weeks coffee is gourmet, small batch, low acid. ethically sourced coffee that is absolutely delicious. I love the Burundi blend and the Ethiopian medium blend. So many different choices at 7weekscoffee.com. What I love about 7 Weeks Coffee is not just that it's delicious coffee delivered right to my door, but that 7 Weeks Coffee fuels the pro-life movement. In fact, 7 Weeks' mission is to give 10% of all of its revenue, not just its profits, directly to support pregnancy resource centers. In fact, 7 Weeks Coffee has already supported 800 pregnancy resource centers, helping moms and babies in need, and donated over $325,000. At 7weekscoffee.com today, you can join the Heartbeat Club where you can get the lowest prices and the best discounts on your monthly subscription. You'll get 15% off a month, and when you use my code Lila at checkout, you'll get an additional 10% for 25% off your first order. So go to 7weekscoffee.com today. Order yourself an amazing subscription of coffee, try out your favorite blend, and get 25% off your first order by using the code Lila at checkout. Okay, so what about endometriosis?
Yes, that's also a very common one.
What's the holistic approach, the restorative reproductive approach to healthcare approach to endometriosis?
Yes, and so what is endometriosis? And so endometriosis is the way I explain it is that when we think about the endometrium is the inner lining of the uterus. That lining responds to the hormones produced by the ovaries. That lining is what sheds every month in the form of our period, which is fine if it's inside our uterus, okay? But with endometriosis, and this is an absolute oversimplification because there are many different theories of how endometriosis develops, but I just think of those similar types of cells in other places of the body, okay? Typically in the pelvis. But here's the thing, they're still responding to the ovarian hormones. And so therefore, with all those changes in the hormones, they're still potentially like almost bleeding into themselves. And that can cause a lot of inflammation. It can cause, obviously, the pain symptoms. It can even cause scarring, which is an issue if there's endometriosis on the tube, for example, right? Because it can scar it closed potentially.
And that prevents the egg from being able to reach the uterus.
That prevents the union of egg and sperm, and therefore that baby develops and forms in the outer part of the tube typically, and then travels from there to the uterus. And so, yes, it could have effects at different places depending on the degree of stricture, stricture, and then or blockage. Blockage they wouldn't even be able to meet, right? So, yes, there can be implications for fertility. In fact, that's why 30 to 50% of patients with endometriosis may deal with infertility, and 30 to 50% of patients with infertility may have endometriosis. And so it's a condition that has a lot of wide implications, again, just similar in that way to PCOS, okay? And so the typical way that we make a diagnosis of endometriosis is by doing a surgery, by looking, by seeing, by visualizing, by biopsying it and looking under a microscope, confirming it, okay? For a lot of women, for many reasons, that is not something they're interested in, at least immediately. And so we can presume sometimes a diagnosis because women will very often present with pain symptoms, pain with periods, pain with intercourse, pain with bowel movements. And so for those women, there are other ways that we can presume a diagnosis. But if a woman came to me and she said, I really just want to try to non-invasively help my terrible pain with periods, what can I do? What I would say is we should look for obviously other causes and rule those out, number one. But number two, there is interesting data supporting that if we can pursue an anti-inflammatory diet in many ways, that will help them with their pain with periods. A Mediterranean diet is a great one to just use for everything. I mean, there are studies showing it increases our lifespan by 2 to 3 years even. So there's a lot of reasons to do that. Lots of green leafy vegetables, healthy fats like fish that are low in mercury, whole grains, organic olive oil, nuts and seeds. That's kind of the Mediterranean backbone. And so we'll really start talking about how we can have them on a good nutritional plan. We also talk through how to limit toxins in the environment. Okay, again, this can feel like a rabbit hole, and I always tell my patients to not be overwhelmed because all the data show that small changes can have profound impacts. And so just decreasing perhaps your fragrance exposure or changing
like
over
perfume fragrance or household products that have fragrance.
any of the, yeah. Yes.
What about scented candles?
That one, yes, that one also may have impacts. But again, this is where I also start telling people that we have to give ourselves lots of grace, and we have to. Many times, what I see is that there's this propensity to start restricting everything for this future goal, and I completely understand that. But we also have to be able to enjoy the here and now. So if women want to have a candle and they've changed out their laundry detergent to, fragrance free. So yeah, exactly. Great, right? So a lot of
keep one candle.
yes, exactly. Please.
On special days, you can light that candle.
So that's what I mean. A lot of the data show that as long as we change the quartiles of exposure, if we bring them from the highest quartile of exposure down to the lowest, that can have profound impact. So that's more the point. But we can also use different support in the sense of there are interesting studies showing even calcium and magnesium. By doing this, there's a statistically significant decrease in pain with periods.
Well, I remember getting on a supplement that a girlfriend recommended to me. This was probably a decade ago because of painful periods. I didn't have extreme pain, but at the time I was looking for solutions. She had extreme pain, and I took the supplement, which I think was heavy in magnesium and calcium. And I had pain-free periods as long as I was on it, which was remarkable to me that it worked that well, that quickly. So I must have had a deficiency I didn't know.
Yeah, so there's randomized controlled trials looking at this and showing a benefit. So I'm so glad that a decade ago was out there, right? Even the B vitamins, there's studies showing that by using those, especially a methylated
I think
form.
it had that too. And it was like kind of a concoction of all the things that could help,
Yes, that's exactly right. And so omega-3s are great at decreasing inflammation. Or again, the natural component to that is really upping your intake of organic extra virgin olive oil, or again, the fatty fish, like the ones low in mercury include sardines, mackerel, anchovies, salmon, herring, to try to have a couple of servings of those a week. Or the nuts and seeds, tree nuts are great, as long as it's great to store them in a freezer just to prevent them from undergoing fat oxidation. Again, I don't want to put a lot of rules for everyone, but that would be the ideal way. So these can all be helpful. And then we can start diving into other factors like, again, that N-acetylcysteine or glutathione, which can help with the prevention of free radical damage, like the something called CoQ10, which is a mitochondrial cofactor. And as the mitochondria are the energy powerhouses of our cells, this might be beneficial in helping with some of that pain. So we can really develop, I'm usually not limited by the amount of supplements that we can start. We want to do it, again, judiciously, remembering that first of all, it's a bridge. I don't want to be on all these things forever. Second of all, what can this woman do in her daily life that won't make her feel overwhelmed, or if she hates pills, like what can we do that is reasonable? But there are a host of different supplements that we could put people on.
What about cystic acne? I know that that's a common challenge for a lot of, especially young girls after puberty. And they present with, yes, heavy periods, but also cystic acne, and then they're prescribed birth control.
Yes. And so cystic acne also has different causes behind it, right? And so I would be interested in assessing their menstrual history and making sure they don't have PCOS, because it is just so common. But it can actually be a reaction or a relation to foods and different allergies. And so dairy may be associated with this. And so they can try potentially different elimination diets to see if that helps them in making that, in improving it. Okay. I would say that the gut is the center of everything. And there's more and more research coming out as the Microbiome Project has showed how important our good guy bacteria, which is what the microbiome is, and how it helps us and has connections to different, from one organ to the next, like the gut to the brain, for example. And so we really want to support a healthy microbiome. A lot of girls and women I see are dealing with many GI issues, bloating, change in stools, reflux, nausea, for example. And that can be related to several conditions, but it can also be related to what we colloquially call leaky gut. And why that matters is because our immune system, actually, much of our immune system resides within the gut. It's the GI-associated lymphoid tissue. And typically the intestinal junctions are what we call tight. That means that if I'm the immune system, I can't see out if the junctions are tight. When we think of leaky gut, you kind of think of this, the junctions are impaired. And so that immune system can start kind of recognizing what's inside and start becoming sensitized to that. That can lead to the development of autoimmune issues. What is that? Our immune system's our defense system. It protects us from foreign invaders, which is a good thing. But I think of autoimmune disease as friendly fire, that the immune system mistakenly recognizes one of its own as enemy and starts attacking that. And so a commonplace is thyroid, for example, which I see unfortunately commonly as well. But anyway, the gut is so central that if they're dealing with any gut conditions, we need to focus and heal that because it might be related to their acne. And I would say a probiotic might be a very worthwhile approach. I know that it's very common to be placed on antibiotics for acne. And again, imagine what that's going to do to your gut bacteria. And so this can start becoming worse and worse because of some of the treatments. And I would say that there's interesting data looking at different types of light therapy to help with acne. And so blue light, red light therapy has some benefits too. So it's something else that they could pursue.
Okay, so fascinating. I want to get to fertility treatments.
Yeah. Mm-hmm.
But before we do that, you mentioned earlier, I think your cycle, our cycle as women, as the fifth vital sign. So explain that, because this is, I believe, the foundation of fertility awareness-based methods.
Yes, absolutely. And so I say that it is the fifth vital sign because a woman's, again, that natural cyclicity that we should see is beautifully and very intricately controlled by a lot of different feedback loops and a lot of interactions between different hormones. And so it results in our period. It results in ovulation, okay, which is actually the main event. And if there is a disruption to any of those factors, it will then manifest as an abnormality in the ovulatory cycle. And so again, fertility or abnormal cycles, those are still symptoms. We need to get at why that is happening. And so the vital sign component comes in where if there's an abnormality, let's figure out the why. And that's where you start undergoing different hormone testing. You start looking at the structure of the pelvic organs to to see if there's anything that needs to be addressed, for example.
So when we talk about fertility being a sign of health, is that the right way to look at fertility? If you have a healthy cycle, it's regular, you don't have a lot of pain associated with it, you are in a position, if you wanted to be able to get pregnant and it's not some big mountain to climb, that's a sign of health, and that means that your system is working.
Well, I think that it shows that all of the factors that could be impacting your health and your fertility seem to be optimal, okay? And so I would say that even that fertility may be impaired even in women who have who are ovulating regularly, who don't necessarily have pain. And that's because dealing with difficulty conceiving can be due to a myriad of factors, okay? Be it what we think of as factors within the woman, like ovarian-related, tubal-related, uterine, the endometriosis. Those are some causes. Again, even changes in the microbiome versus male factors or combination of the two, okay?
So increasingly, women are struggling with infertility today.
Yes.
And why? Why is that? What are the different kinds of infertility? And then how do we treat them holistically?
Yes. And so I always want to preface this by saying that there is always hope. You know, out of the couples trying to get pregnant, 85% of them will conceive within a year. After additional 3 years, another 50% will conceive. And so after 4 years of trying, 93 to 95% of couples will, okay? And so not only that, but I have seen it all. So again, medicine is never an absolute. That person, that couple, that is the first time that has ever happened for that couple. And so things, even when they may have a what we call a poor prognosis, which is just there may be several factors that make it less likely by the numbers to get pregnant, anything can happen. I've absolutely seen that before.
So for the couples that are experiencing infertility, what are some of the common causes of infertility, and what are the holistic or the reparative reproductive healthcare treatment options for them?
Yes, exactly. That's a great question. And so we know that many times it's due to an issue, again, within the uterus or the ovaries or the tubes. So that's a female factor is what we call. There's another 30 to 40% of the time there might be a sperm issue that means either lower concentration, lower motility, a lower number of normally shaped sperm. And then there can be other factors like the endometriosis, as I said, okay? There is a subset of couples where it's called unexplained, and that can be even, the numbers say anywhere from 10 to 30% of the time people will maybe given this diagnosis. Again, there could be hormone imbalances or endometriosis within that group that is being called unexplained that we should try to look into more, okay?
And do you think that unexplained diagnosis is in part not enough care is being taken and time to understand why the patient is facing infertility, or is that really, it is just unexplained and who knows?
Well, Lila, I think that's depends potentially on that specific case, okay? But I will tell you that previously, decades ago, it was very common to do, for example, laparoscopies to diagnose endometriosis. It was more common to do other tests to look for things such as what we call a cervical factor. And as more and more roads seem to lead towards IVF, I feel like there has also been less of that assessment for those factors, for example, and just more of a push to, well, let's just try IVF at this point. And so I think that, again, everyone's trying to do their best, but it's what tools do we have in our armamentarium? And I think that we do need to expand these tools, okay? What do I mean by that? Well, a very common one that I find in a lot of women is that there are still hormone imbalances that are present, even potentially in women with ovulatory cycles, okay? What does that mean? So what that means is there could be imbalances in what we call gonadotropins, which is just FSH and LH, that's the fuel, I think of it, that goes and starts a race to ovulation in the ovaries. And what I found very commonly in this decade is that these FSH and LH may be not as high as what I would love to see. And why? Stressors may impact this. This could be emotional stressors, nutritional stressors, physical stressors, like working out for hours a day, for example. But regardless of that type of stress, the body can go into survival mode and says, okay, I can't support anyone else. I have to conserve my resources. And part of that conservation is not releasing as much fuel. That's a big deal because I won't bore you with all of the details. I mean, I find it fascinating, but there's a lot of receptor dynamics that are all designed to make that egg that is developing, and that's the one that will be released, the best quality. And so that goes from a macro level, from production of male hormones, the androgens and estrogens, to even a micro level. There are these amazing electrical pulses that have to go through the egg to help mature it. And so any change and lessening of that fuel are going to potentially have an impact on the egg. So that's one that I see a lot that isn't always evaluated. Thyroid is incredibly common, relatively, in the patient population that I see. And then there can be other hormone imbalances like an increase in prolactin. That's a hormone that is designed to help us produce milk after we give birth and we're nursing. But sometimes, due to different reasons, it can be elevated. And this can have a significant impact on fertility and ovulation and even progesterone production after the egg's released. So remember, progesterone is critical for that baby developing. And so if there's a decrease in that, there might be, therefore, an impact on the pregnancy.
So if you have thyroid issues, how would even you have thyroid issues if you're experiencing infertility? And then what would be the treatment for thyroid issues to help you regain your ability to get pregnant?
So thyroid is a gland in our neck, and it is involved in everything. It's involved in our metabolism, in our energy levels, in our cardiovascular system. It's involved even in our hair, in certainly our fertility and cycles. And so people may have symptoms very commonly. So it's more common to have underactive thyroid than it is to have overactive thyroid. And so the women who have underactive thyroid will come in saying, I am so fatigued. I wake up and I'm tired. I have brain fog, potentially. Cold intolerance, meaning they're freezing. They'll have very cold hands and feet. They're losing hair. They're constipated. So that's some of a constellation of more common symptoms that I'll hear about. The flip side, the overactive thyroid, is kind of the opposite of all those. And so what we'll commonly do is a deep dive in their blood work and try to assess for their thyroid testing. Again, it's all, I liken reproductive endocrinologists to kind of like engineers. We love feedback loops. And so there's a feedback loop that goes from the brain, the TSH, to the gland. The gland then pumps out hormones in response to that signaling from the brain. And there are different types of hormones that get released. And then those hormones go back up to the brain and says, okay, we're good. We don't need any more thyroid hormone. You can turn down the signal. And not only that, we'll look and assess for autoimmune attack on that thyroid gland, as I was mentioning earlier, because that can also become an issue. There's interesting studies actually tying that autoimmune attack marker on the thyroid to a potential increase in pregnancy issues, including miscarriage, including issues later on down the line for pregnancy, depending on what that woman's current thyroid function is. And so that's the start of the way we evaluate for thyroid. The treatment for thyroid is multifactorial, but it would include the replacement of thyroid hormone and then watching and titrating that very carefully, as well as, it's interesting, even a lot of cruciferous vegetables, which is typically my favorite type of vegetable to recommend because they're full of antioxidants, they're anti-cancer, they're wonderful. But for women who are dealing with thyroid, they might be what we call goitrogenic. So it can cause a thyroid goiter. So that would be one way is to say to someone, if you're eating cabbage or broccoli or kale 3 times a day, maybe we should decrease this, for example. So that would be a dietary change. You want to make sure that your iodine levels are appropriate. And so that would be some nutritional approaches. Certainly there's a lot of anecdotal evidence showing that decreasing potentially gluten or working on fixing the gut can potentially help with thyroid because of that autoimmune connection. And then there might be some supplements that could help. So one is inositol. That is a sugar moiety that also is used very commonly in PCOS, and it's a heavy metal chelator too. There's a lot of uses for inositol, but there's some interesting studies showing for autoimmune attack on the thyroid gland, it can be useful. And so there are a few other supplements we can start to use to support that thyroid.
As I've shared on the show before, I'm very picky about my skincare routine. In fact, I've tried many products over many years and never landed on a product line, a brand that I really love. And then I discovered NimiSkincare.com. That's Nimi Skincare.com. Nimi Skincare is a company that shares our values. It's pro-family and pro-life, but it also is a high-quality, clean skincare brand based on decades of research. They use clinically proven ingredients, and they've got incredible products. Go to NimiSkincare.com today. Check out their lines. I love how simple the products are to use. I love that the ingredients are clean. I really enjoy the hydration cream as well as their brightening sunscreen that I use every single day. I know you or the woman in your life will love their products. So go to NimiSkincare.com today. Use the code Lila at checkout for 15% off your order. That's NimiSkincare.com, and you can use the code Lila at checkout for 15% off your order. So what would you say are the top three? I mean, I think you've mentioned some already, but the top three causes for infertility. And you just deep dive thyroid for us, but what are the holistic treatments for those?
Yes.
We already covered maybe at least one of them, but what are we missing here?
So
what
I would
else
say that
should we explore?
Irregular cycles, we've really touched upon in different facets of it. And this one, again, is very amenable to a restorative approach, because if we can get that woman to ovulate normally, if we can restore her hormones and make them optimally balanced, we can hopefully, the goal is that she gets pregnant on her own. Okay, so that's one. I would say that that there could be sperm issues. The sperm life cycle is every few months. And so what that means is that if there are lifestyle factors involved, the good news is that we can try to make some changes in that man's lifestyle, and perhaps there will be a new group of sperm that have now been exposed to these optimized lifestyle factors. And so this just, again, is as foundational as having a healthy diet. This could be as simple as trying to limit our processed foods, trying to eat more organic to minimize the amount of pesticides, quite honestly, that we're consuming.
So those things, pesticides and non-organic foods, could be killing men's sperm count.
That there seems to be some association.
Or sperm quality.
Yes, and we think that, it's, again, lots of different reasons, but we know that over time, we have an increasing rates of obesity, of metabolic issues, of these environmental toxins. And so as we're surmising what is happening and why fertility is being affected and sperm counts, these are certainly actionable areas where we can potentially change this, right? Of course, the classic toxins, so that's like drinking, alcohol. Smoking is, alcohol's a little bit more mixed in the data, but I say that we know, it's something to consider if someone's dealing with a sperm issue.
Any alcohol or don't get drunk alcohol?
So that's what I mean. So the data is not as clear. It looks like you can have, it's really more at higher amounts that there might be an impact on sperm or an association with that. Smoking is one where it's a toxin and it can hurt the sperm. Okay.
What about having your phone or your electronics near? I mean, that's just like, there's sort of like the trending on X sometimes, things to do for men's fertility and take the phones away. Wi-Fi has been called out as a potential negative for men's fertility. So is there credit to that?
So I would say two things. First of all, the data to date don't show a clear association between this. But the second thing that I want to say is just because the study hasn't yet been done or hasn't been done on a scale or in a proper design doesn't necessarily mean that it's not real. So again, we have to think about what do we have in our control. Like fertility is out of our control at the end of the day, right? And that can feel very hard, and I'm saying it a little bluntly, but at the end of the day, we can't say you will have this or you will not. Like none of us are in absolute control. For me, God is the one in control of that. But what I would say is that how can we empower ourselves to make sure that things that are in our control are as optimized as possible? And so even though there may not be current data, I think that, there is an impact of electromagnetic fields that we're being exposed to more and more. Why not just move it? I don't think it's that big of a deal for most people to keep that away from their reproductive organs. I'm absolutely an advocate for that. So
what about stress? I've heard anecdotally the experience of a lot of women who they feel when they're more stressed, it's more difficult to conceive. I also want to get into miscarriage because that's another aspect of this. But I've heard, when I was less stressed, when my stress levels went down, my cycle returned. You can actually miss a period if you're really stressed or you're not sleeping enough. How does that impact fertility?
So again, it's one of those where the data does not support a clear association between stress and infertility, okay? And I have to emphasize absolutely that for the vast majority of my patients, absolutely, none of this is their fault, which is a very common sentiment, that they're just are looking at everything they did do or didn't do. And this is the same with miscarriages, right? And they're racking their brains and actually feeling so much guilt. And so much of it is absolutely not their fault at all, okay? So I want to put that out there because that's very important.
It's good you mentioned that, because I think about, for example, one woman that I know that I look up to, an older woman, and she talks sometimes about, we've had conversations about miscarriages that she had, and she wonders, was this miscarriage because I was too stressed out, because I wasn't, being more of a gatekeeper with my schedule, and there is that common tendency to just blame oneself for these things and wonder, what did I do wrong?
Yes. And again, I see women all the time with this, and that is absolutely not the case. We bring it back, though, to, well, what about the physiological reason that we want to try to help and try to recenter ourselves on a daily basis? I think that's more actionable. We all have stress. We all have stressors. That is life. That is this decade for sure. And so, how can we try to improve our stress levels, and why does it matter? Well, again, remember we talked about that FSH and LH and how important that is, and how we know that can ultimately impact the ovarian hormones that are being produced. And so I think it is a good idea, again, to just get those things tested, to rely upon the fertility awareness-based methods, because those can, as external signs, tell us about how our hormone balances are. And again, stress may have a downstream effect at changing our estrogens or progesterone production. Okay, that's one. And I would say that for miscarriages in particular, with that sense of it, there are so many other factors that can be assessed and improved. And I absolutely encourage women who have had even one miscarriage. I know many times people feel badly going back to the doctor. Why not just get a baseline hormone panel? The best, it will give you peace of mind moving into trying for that next pregnancy, or you'll uncover something that you can then correct.
Alongside lifestyle changes, and you mentioned some surgeries to kind of determine if there's some physical issues, with the anatomy that you are preventing you to be able to conceive. What are some other concrete things that can be prescribed or done for a patient who's struggling with infertility?
So,
like Clomid, for example.
Okay, got it.
As a drug that I think it can be perfectly, more from the moral perspective, it can be perfectly illicit. You're not using it with IVF. You're using it just to try to ensure you ovulate more, or you can ovulate. Walk us through some of those treatments.
Sure, absolutely. I will say also, just as another baseline, there's some interesting studies that show that there are a pro-fertility diet that I encourage women to follow. And so that's, again, very similar to a Mediterranean diet, but it actually, this surprises some women, it includes full fats. And so people think, wait, why? It's because cholesterol is the building block for all our hormones, for example. And so that's one that people can look up and pursue. And then the second one is actually looking at the amount of exercise. This, again, relates to stress in many ways. So I don't want to have, this is where you talk and make a plan with your doctor. But if your BMI is between 19 and 25, you actually may want to consider not doing as high intensity of exercise, because it may lengthen your time to conceive, potentially. That's been associated in some studies. If your BMI is 25 or over, which is a body mass index you can calculate, you can have any sort of exercise in any capacity of intensity, and it will help shorten that time to conception. So those are two other baseline things. So in terms of the types of fertility treatments that I do and that others can do, well, it of course depends on the cause, right? And so we will consider using surgeries or different methods if there seems to be an issue structurally inside the uterus, like a polyp, pretty common, that can cause irregular cycles or spotting in between. Sorry, not irregular cycles, but irregular bleeding, meaning longer, heavier cycles, potentially spotting in between cycles, okay? This can also prevent implantation or increased risk of miscarriage. So that one can be corrected very easily. Again, endometriosis, there are some studies supporting that there can be an improvement in pregnancy rates after surgery for removal of endometriosis. So there are those foundational issues for these specific causes. If a woman's having irregular ovulation, a very commonly prescribed medication is what we call oral ovulation induction agents, okay? That's a fancy way of just saying that we can give medications to provoke ovulation to occur, okay? Clomid is absolutely one of them. It's actually not as commonly in use anymore. There's another agent called letrozole. They both function in a very similar fashion, even though they're different classes of medications. But essentially what it does is it almost like causes the brain not to realize that estrogen's rising. And so as a result, the brain puts out more FSH and LH. Remember, we talked about that fuel. And so the way I think about it is that every month in a woman who is ovulating regularly, there's a group of follicles, each having one egg in it. And I think of the follicle as a car, and I think of the egg as a driver in that car, and they're all at the starting line of this race. And it's just like any other race. There can only be one winner. Typically, only one egg can cross that finish line and be released. And unfortunately, the rest of them, they don't get to race again. They dissolve away. And so the signal, that fuel source that I'm saying that starts that race, it comes from the brain. It's FSH, it's LH, just fuel. It goes to the ovaries, it starts the race. They're all madly racing. They want to win. Their exhaust as they race is estrogen. Lots of effects, including going to the lining and thickening it up. And then once that winning egg crosses the finish line, that empty car, so to speak, starts pumping out progesterone, which goes to the lining and makes it really receptive for an embryo to implant there. Okay. And so that's the basics. What do these?
I love the way you describe that.
I usually draw it out for people.
That's the best description I've ever heard of egg release.
I can go way more into it. Actually, I'm trying to keep it short. But every patient I've ever seen knows my upside down drawings.
I love that.
This. Thanks, Lila. And so, when we think about, well, how does Clomid or letrozole work? What it does is it ramps up your body's own fuel. And so the goal is either to make that race happen if it's not, or sometimes we want to get 2 or 3 eggs to run that race, maybe to try to increase probability of pregnancy. And so you're going to have more fuel, therefore potentially more winners, okay, if you will. And so again, letrozole is an aromatase inhibitor, and it does that same function. It is not FDA approved for this as unlike Clomid, which is, okay, but it's used very commonly. And that's because there are some studies comparing the two, and it seems like letrozole improves ovulation rates and pregnancy rates, okay? And so that is a great option. It's overall very well tolerated. And I can go into side effects and risks and whatnot, but I think that is a licit way, absolutely, that has been shown in studies to help optimize and improve pregnancy rates. Another support that can be used is even just watching that cycle more closely. So monitoring with ultrasounds, it's actually amazing. You could watch the follicle, you could watch that race happen in real time. And we know that for certain follicle sizes, the chance of maturity of that egg increases. And so, for example, at 14 millimeters diameter of a follicle, since we can't see the egg inside, right, on ultrasound, that follicle may contain a mature egg, okay? We know that around 20 millimeters, it's very likely to contain a mature egg. And around 25 millimeters, that's the average size at the time of spontaneous ovulation that a woman will release that egg. And so we can track all of that. We can track the thickness of the lining. And so we have a lot of ability to see and try to, again, optimize and potentially intervene if it appears that that process isn't occurring as it should. Another type of intervention that might optimize pregnancy would be giving progesterone supplementation after ovulation. It's interesting because there's actually a divide between restorative reproductive medicine and kind of conventional REI in regards to this. And conventional REI has really decreased the use of luteal progesterone. There are some studies that were done that didn't seem to support improvements in pregnancy. And then the argument is that, well, progesterone is released in a pulsatile manner. And so if you do measurements looking at progesterone in your blood, you might be catching it at its trough, for example. And there's other studies that are quoted. With that being said, again, I actually have seen a lot of women who have progesterone issues. Again, it might be tied into that stress and the FSH and LH response, okay? Number one. Number two, we'll see it reflected in their fertility awareness-based method. So they're charting. You can actually see their progesterones, their cycle's not as optimal. And number three, progesterone, bioidentical progesterone overall is very well tolerated. There are large series looking at it when we use bioidentical that support its use even in pregnancy. And so that is certainly an intervention that I use for patients.
Fascinating stuff. All such important information. I know we've got to wrap here soon. What is there anything more that you think, I mean, there's probably a lot more, but any other thoughts on the holistic approach to infertility? Anything else that you think people really should know?
Yes, I would say that, again, just to throw back to what I was saying earlier, this is not simply about this acute assessment, acute fix, acute solution. This is something that will help that woman's overall health. If we help that woman and her wellness, we are going to be helping with that pregnancy. We're going to be helping potentially with that baby, right? Of course, prematurity can affect babies. There's a Barker hypothesis that says that whatever happens in the womb can affect baby throughout his or her whole life. And so it's just a great strategy to ensure wellness for all. And not only that, it is an effective, there are studies showing that restorative reproductive medicine has similar and comparable live birth rates compared to these cycle of IVF, okay?
Wow.
So it's effective.
That's incredible.
Yes.
So you're saying that there's studies that show that if you approach the restorative, if you use the restorative approach to infertility versus just going for IVF, the results are similar.
That it appears the results are similar in these prospective cohort studies that were done. So it is effective. It may take some more time, right? But ultimately, there are similar efficacy, number one. Number two, from a financial perspective, from a medication perspective, it's a lot less intensive than something like an in vitro fertilization cycle, okay? Number three, there is less risks. We already kind of went through the maternal risks, the risks to the children. Risk of multiples is so much lower with it. Number four, it's a morally licit way to try to conceive. And so I think that, again, we should start with that. We shouldn't necessarily start with these uber aggressive treatments. I think that there's a lot of reason to be focused on the why and to help heal that.
Such good stuff. Thank you so much, Lauren.
Yes.
Okay, where can people find your work? And you're practicing, so
yes.
I know that when I did the first episode, I had a lot of people say, I'm so excited. I wish I lived where she lived, or can I reach out? Can I do a Zoom call with her? How can people find you?
So they can find me on my website. So laurenrubalmd.com would be a great way to start. And yes, I am happy to help.
Thank you so much.
Yes, thank you for having me.